My name is Dr. Rene Loewenson. I'm the Director of Training and Research Support Center and also a cluster lead in the Regional Network for Equity in Health in East and Southern Africa. My research interests are in various dimensions of equity in health, including on commercial and social determinants of public health and public health policy around it. The study in the AEGT project that we are working on, I'm doing together with the country managers and the teams from the four countries, Zimbabwe, Zambia, DRC, and Tanzania. And we are also kind of putting together the regional implications of that work from TASK, from Training and Research Support Center, and feeding it through our networks in AEGT and in Equinet. The work we are doing is basically looking at moving from ad hoc surveys and efforts to expose health in the critical minerals sector towards institutionalizing health impact assessment as a method to more systematically expose and also address these health impacts in the sector. So the work has two dimensions. One is that it's exploring policies, laws, activities in the sector and looking at whether or not they're addressing the health impacts and exposing those health impacts. But it's also looking at the learning we have about how to institutionalize health impact assessment as a tool in the sector. What we've actually been able to collect is through the reviews of the studies that have been done, or through the research that's been done, through the systematic health impact assessment process, we've been able to see, for example, in Zimbabwe, looking at a particular activity in the ASM sector for a critical mineral, which is both mining and milling and also waste management and transport, we've been able to see what are the health implications of this sector, of this activity, which could be generalized to other activities that are similar in the sector, and how far are they being addressed, and what are the key recommendations to improve it. And then in both Tanzania and in Zambia, we are looking at legislative or strategic proposals that are being made around dealing with the sector. So in Tanzania, the critical minerals strategy, and in Zambia, the new legislation on mining and health, on mining generally actually, and look to what extent they are addressing the health issues, and therefore the proposals as to how they should better integrate the health issues. So there's new information emerging about things that are not being recognized in these kind of policy documents. And then in DRC, looking at the ASM sector in cobalt in a particular area, and using it to interrogate the extent to which the current system is actually addressing those issues. So the information coming out is bringing together, both from their own prior fieldwork as well as from extrapolating from studies that have been done in the sector, what are the kind of health impacts, who are they affecting, why are they affecting, what are the determinants of these impacts, and therefore, what needs to be done to better enforce and apply the current decrees and regulations that they have. Then across all four studies, we're looking at policy implications and institutional implications of this work. So we have been engaging with policy actors, both at regional level and at national level. So I would say that in DRC and Tanzania, the engagement has been a little bit more limited because of the current situation in both of those countries. It's both the electoral situation in Tanzania, the conflict situation in DRC has made it a bit difficult to engage the national policy actors on this, but they've been engaging at the local level with the findings and will continue to do so. And we did have the opportunity in the AEGT meeting to present the information to Tanzanian policy actors, so that was also useful. But in Zambia, they have already presented the report to the various ministries. And I think there is an ongoing process of looking at how we can move the policy process forward in Zambia, where we are building a critical mass of capacities around health impact assessment, and where there's reasonable public health capacities to work with. And then in Zimbabwe, we have made significant strides because actually health impact assessment is in the Public Health Act, so the dialogue has been about how do you operationalize this. And we've been able to present the AEGT studies, but also other studies that have been done in the course of our online training on health impact assessment in national forums. And we have now a technical working group on health impact assessment in the country that involves the ministry, convened by the Ministry of Health, but also involves the Environmental Management Agency, the Office of President and Cabinet, as well as key sectors, whether it be mining, transport, infrastructure, local government, and so on. So from that work in Zimbabwe, which is more advanced, we are learning a lot about the steps towards institutionalizing health impact assessment in countries. And we plan to bring this dialogue to the East Central and Southern African Health Community forums of directors and ministers, where they have already passed a resolution to institutionalize health impact assessment. So we're really bringing the evidence on what it yields and how much, how to move forward with it at country level, and we'll be dialoguing and getting further information from the health leaders in the region on what do they see as the enablers and barriers. I think we're continuing to work with the AEGT program on consolidating this work through moving to more strategic health impact assessments that are more multi-sectoral, that engage actors in the research process itself rather than waiting to engage them afterwards, and also to look at things like how are the current environmental impact assessments, which are being done in countries, addressing health issues, so that we can be clearer about why we need to do health impact assessment. To reveal the kind of findings that we found in these studies about undetected and underreported health issues, particularly chronic disease issues. The accidents and injuries are more well recognized, but the chronic neurotoxicity, the cancers, the lung diseases, etc., as well as the intergenerational impacts on unborn children or neonates and on children themselves are not being detected in these countries, but we have shown them in the studies and therefore are able to raise policy attention to them.